We've all encountered different skin conditions, whether for ourselves or our loved ones. On today's show, we will take a closer look at these skin conditions and figure out the best way to treat and manage them. And as always, we will answer your questions on this episode of Ask the Doc, No Appointment Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hello, and welcome to this episode of Ask the Doc, No Appointment Needed. I'm Dr. Yuval Bibi. I'm a board-certified dermatologist and a best-selling author of skincare books with offices in Broward County and Palm Beach County, here to answer your questions. And let's go to our first question, submitted by Brian. I'm a 52-year-old male athlete who has played sports outdoors my entire life. Lately, I've been seeing red bumps pop up on my body. How do I know the difference between normal bumps and dangerous lesions? And Brian, that's a great question. And what we usually pay attention to with skin lesions, these are bumps or specks or spots that stand out from the background of the skin from the rest of the skin, are the A, B, C, Ds, and E's. That's an acronym or an abbreviation that stands for several signs that you want to pay attention to. The first A stands for asymmetry. And asymmetry is something that should concern you about a skin lesion, because skin lesions that are benign are often symmetrical, meaning one side of the lesion is almost identical to the other side. And that is something to pay attention to. If something is asymmetrical, it may be a sign that something is off or something is wrong with that skin lesion. The next sign is B, and B stands for border. And borders of benign or harmless skin lesions are often well-defined. They're easy to distinguish or to tell apart from the surrounding skin. When the border is jagged or rough or fuzzy, meaning the lesion is not well-defined and doesn't stand out from the surrounding skin very well, that could be another sign of concern. The next sign is C, which stands for color. And benign skin lesions are often evenly colored or symmetrically colored, meaning the lesion appears the same color throughout the lesion, or if there's different colors, they're at least symmetrically aligned throughout the lesion, like a bullseye, for example. But when that is disrupted, when that is not the case, that could be another sign that something is indeed wrong with the lesion. Then the next sign is D, and D stands for diameter. Now, benign skin lesions are usually below a certain diameter, usually below the size that is 6 millimeters, or about 1/5 of an inch. Anything that is larger than that, especially if it's growing to that dimension, should be something to pay attention to. Now, the next sign is E, which stands for evolution. And evolution means that the skin lesion is going someplace. It's actually changing. And changing skin lesions should be something to definitely raise the alarm bells and have you go to the dermatologist to check in with them to make sure that the lesion is fine. Now, not every skin lesion that shows those signs, that has positive signs of any of the signs that I mentioned earlier, is necessarily a dangerous skin lesion, but it definitely stands out. And lesions that stand out, as in what we call the ugly duckling, lesions that are different from all the other lesions in a distinguished or noticeable way, those lesions should definitely raise concern and have you go to the dermatologist and have that lesion inspected and examined and its nature clarified with the doctor. Now, there are additional signs to pay attention to, and those are less well talked about in the popular culture, but anything that shows up that stands out, first of all, I always tell my patients, bring it in. I really don't need you to have a well-defined reason why you brought it in and we're concerned about. And the other two features that I tell people to pay attention to are sores that appear out of nowhere or sometimes appear with a clear story, but are still persistent on the skin, because most people's skin heals with any injury, abrasion, or a wound. heals pretty quickly. And sores that persist beyond 2 or 3 weeks are one sign of concern. Sometimes that could be a sign of skin cancer. And another sign are pimples that appear or bumps that appear out of nowhere and persist for more than 2 to 3 weeks. That could be another sign for you to pay attention to. And it would be a good idea to go into the dermatologist office with lesions that show up and are concerning to you to clarify those lesions, because many times people kind of think that they're supposed to know whether a lesion is of concern or not. And often they're surprised to find out that those lesions are actually either no big deal at all or something to be concerned about and to be doing something about. And I hope that answers your question, Brian. Let's go to the next question. And we have Melanie, who wrote us, I just moved here from New York. I love it, except for one thing. My eczema seems to have gotten worse. Can you tell me if that is normal? And if so, why is it happening? Well, Melanie, I am so glad you asked me that question. So first of all, welcome to Florida. And you're experiencing something that many people experience when they move to Florida from the Northeast or from New York, and that is drying up of the skin. Now, what most people don't realize is that Florida, especially South Florida, can be exceptionally dry. Now, a lot of people wonder when I raise that fact with them, they're saying, well, how is that dry if everything is humid out here? And what we need to pay attention to is where people spend most of their time and the nature of that environment. And that is inside the home or inside closed doors, behind in a building. And those buildings in Florida, South Florida in particular, are all air conditioned. And the reason why they're air conditioned is to keep the walls intact and to make sure that the walls do not crack and do not develop mold or other issues. So the air conditioning in the Florida home, especially the South Florida home, makes up for a very dry environment, and that's where people spend most of their time. So when you spend more time in a very dry environment, your dry, sensitive skin and your eczema are sure to go haywire, and things often take a turn for the worse. That is a very common scenario or very common occurrence in people who make the transition from the Northeast and other areas in the country as well to South Florida, because they spend all that time in the air-conditioned environment, which is kept that way 24/7. So what do we do about that? Well, first of all, we need to realize that that is the case. All the humidity and the mugginess outside is really not at play when it comes to your skin in Florida. Most of the time, you're in a dry environment and you need to act accordingly. So first of all, do not do anything that makes your skin worse, as in avoid using hot water on your skin, which is an exceptionally abrasive factor. Also, try to minimize harsh soaping, use of detergent on most parts of the skin, especially the arms and the legs where a lot of the eczema occurs, sometimes on the torso as well. Obviously, avoid the physical abrasives, which are completely useless in most cases, like the scrubs, the exfoliants, the loofahs, the brushes, the washcloths, and so on. Avoid these things as they are abrasive to your skin barrier. And if you have dry, sensitive skin, you're prone to eczema, your skin is already having a hard time keeping its skin barrier together, or the microscopic layer that coats the surface of the skin and protects the skin and helps it keep itself together. That is a major issue for people with dry, sensitive skin. Now, the other thing that you want to keep up with is moisturizing, and that is very important to use the right moisturizer on your skin. Moisturizers that work exceptionally well are the occlusive moisturizers, such as white petroleum jelly. And these moisturizers are more on the greasy side of things, but the trick is to use a very small amount of those moisturizers over large areas, spreading it as thinly as possible and making sure that you get, if you will, a shine on that area to protect the skin barrier and let it catch up and replenish itself. I hope that answers your question. Again, welcome to Florida, and I hope your dry skin and eczema take a break and become better soon. Okay, and we have a question from Veronica. I'm 60 years old and have spent years and years out in the Florida sun. I still love being outside, but my daughter is making me nervous when she keeps talking about skin cancer. Is it really that serious? What do I need to know? And what should I be doing? Now, before I answer the next question, let's check out this video.
Skin cancer is the most common type of cancer in the U.S.
There are three main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most common.
Dr. Don Davis says basal cell carcinoma rarely metastasizes or spreads to other parts of the body, but it does destroy tissue in its path and should be removed.
Squamous cell carcinoma is what we think of as the aftermath of precancerous skin lesions called actinic keratoses. And squamous cell carcinoma can spread very quickly and metastasize.
Squamous cell carcinomas can be cured when caught early. Because they do spread, treatment is essential.
And then lastly, there is melanoma.
Melanoma is the deadliest form of skin cancer. It can also be cured when caught early, but if it spreads, it can be very difficult to treat. Dr. Davis recommends you have regular skin checks by a healthcare provider or dermatologist to monitor your skin for changes. And of course, wear sunscreen every day. For the Mayo Clinic News Network, I'm Vivian Williams.
Okay, and Veronica, thank you so much for your question. I think it's a great question to ponder. So first of all, yes, skin cancer can be a problem, can be a serious problem, especially certain types like melanoma and even squamous cell carcinoma. So skin cancer needs to be detected early. And I think that is the emphasis that we need to make, is that, well, we need to get some sun exposure. We need to get some sunlight to support our health and to get a lot of basic benefits from sun exposure. And at the same time, we don't want to go too far with sun exposure. So what I usually recommend to my patients is, first of all, know your limitations of how long it takes for you to actually get sun damage, which is sunburn or deep tan. And you don't want to get that far into sun exposure. You want to limit your sun exposure in an intelligent manner and in a conscious way. And that is what we call sensible sun exposure. Now, sensible sun exposure is where we get about a quarter or maybe a third of what it takes for us to get slightly pink the next day, what we call the minimal erythemal dose. So we don't want to get anywhere near a sunburn and probably not anywhere near a deep tan, but we still want to get those sun rays and get the benefits, the many benefits that sunlight affords to countless people around the world. So everybody needs to know their own skin type and their own relationship with sun exposure and act accordingly. Obviously, not to get sunburned, which is a serious injury to the skin that can be inflicted by too much sun exposure. And at the same time, get the benefits of sun exposure and be done with it. So what do you do about skin cancer? Well, skin cancer cannot be fully prevented. It's something that we are still struggling with in the dermatology and skincare community on how to prevent it. But what you can do, and obviously watch your sun exposure to not get too much of it. And what you can do even further is be proactive about early detection of skin cancer. And that is where you really can take agency and become proactive about preventing things from taking a turn for the worse. So the most important thing is to know what to pay attention to for yourself, so you can actually self-examine and have family members help or friends help you participate in the process of detecting or identifying skin lesions early on in the process before they become a serious problem. And obviously, as we discussed earlier, knowing the A, B, C, Ds, and E's, and looking out for anything that stands out and is persistent on the skin. These are great methods or great ways of detecting skin cancer early, or any concerning lesion early on, and bringing it to the dermatologist's attention so they can actually deal with it head on early and take care of business. Now, the other thing that you can do, and I recommend that you do, especially if you have a high risk for skin cancer, if you've had a history of skin cancer, or if you have a family history of skin cancer, or you just have a lot of sun damage on your skin and a lot of skin lesions, and you don't know which way to go, which lesion is less concerning or more concerning, you can't really make heads and tails out of all those skin lesions. I think that periodic skin checks with dermatologists is actually a great idea. So periodic meaning coming in once a year or once every 6 months, or even more frequently, depending on your own personal risk for skin cancer, your own personal tendency for developing skin cancer and other lesions. And you would determine that frequency by discussing this with your dermatologist and deciding on what would be the best frequency for you to come in. In addition, I think it's always important to keep an open door policy with your dermatologist, because skin cancer can come unannounced. It can come in whenever it feels like it. And this is an arbitrary process. We can't know when the next skin cancer is going to come. And it may come months before your next appointment. So you need to be proactive and on the lookout, and know that you can actually call your dermatologist office when having defined or determined or found a suspicious skin lesion. Bring it into your dermatologist's office for their attention, and have the skin lesion examined appropriately and decide what to do about it next. But I hope this answers your question, and that you can take matters into your own hands and see a dermatologist as needed. Now, there's still time to get your questions in. Here's how.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
And let's take a look at the next question sent in by Devin. I'm a business professional and have a real issue with hair growth all over my body. It's embarrassing sometimes. Can you share some of your favorite hair removal tips? But Devin, I really appreciate that question. Hair removal is something that's very common in popular culture. A lot of people do it, and there are many pitfalls to removing hair. In particular, hair removal can sensitize the skin and can actually make the skin become drier and more irritable, and you can develop all sorts of skin problems from hair removal, such as eczema or folliculitis, and that needs to be done very carefully. So the best recommendation categorically that I can make for hair removal is to watch the abrasion of the skin, meaning you need to be very careful in how you remove the hair so that you don't irritate the skin, so that you don't abrade the skin or scratch on it, and do not upset or weaken the skin barrier by using things like detergents in the process of shaving or removing the hair and other methods. And the other thing to pay attention to is to make up for any deficits that are created in the process of hair removal. Many hair removal techniques are actually abrasive to the skin, meaning they weaken the skin barrier in the process of removing the hair. And that needs to be made up for in the process after, or in the period, or right after shaving or removing the hair, by moisturizing. And that is a very important aspect of shaving or removing hair. So let's take a look at a few techniques that are very effective in removing hair and what needs to be done with them. So shaving is something that's done quite frequently and is a very popular technique. And when we shave, especially if we shave large areas such as the legs or the armpits or even the face, that needs to be done very gently and delicately. So you need to watch, first of all, the temperature of the water. That needs to be lukewarm water. The other thing is you need to watch the level of abrasion or friction imposed by the technique. So many people nowadays tend to exfoliate their skin before they shave, especially on the legs. That is complete nonsense. There's no need for that. That actually makes your skin worse and can actually make your skin far more sensitive. So I recommend to people to avoid exfoliation, avoid the so-called cleansing before starting to remove hair by shaving. Use a shaving gel or a shaving foam or cream to decrease the friction, to increase the glide factor and lubrication of the process. And always use a sharp razor when you engage in shaving, because any one of these elements missing in the process can result in more sensitive skin in making your problems worse after shaving. So always watch the friction factor of your shaving by using a shaving product and a sharp razor, and make sure that that is kept up with and maintained. The other thing is to remember is that when you're done shaving, you don't want to abrade the skin with washcloths or with any abrasive practices or surfaces, and dabbing the product away, washing the area away gently with lukewarm water would be the way to go, following by moisturizing the area, preferably again with an oily moisturizer that will restore the skin barrier, help the skin restore its own skin barrier under the occlusion of that oily product. Now, there are more abrasive techniques out there. Specifically, waxing can be pretty abrasive, and waxing involves applying sheets of either cloth or paper to the skin under the with some wax that can congeal or it can solidify, and then pulling those strips away. That can cause significant abrasion to the skin. And the same rules of aftershave apply to waxing of the skin, especially when dealing with very delicate areas such as the face or the legs. Now, there are some other techniques that are appropriate for large areas, and I'm a big fan of laser hair removal. Now, laser hair removal has come a long way in the last few decades, and it's available to people of all types of skin, all skin types. It used to be a problem for people with darker skin types to get laser hair removal for the fear of causing discoloration. And nowadays, the technique has been so well refined that people of any skin color can actually get laser hair removal. And that is an extremely helpful technique in avoiding the friction and the abrasion that is a feature of both shaving and waxing. So laser hair removal, especially if you are in the habit of removing hair frequently, would be a great technique or a great method of removing hair permanently or at least long term, so that you don't have to engage in hair removal as frequently. You certainly will not sustain the same abrasion that is inherent or is the default setting for the shaving and the waxing. And that can be very, very helpful in minimizing the sensitivity and the irritation of the skin after shaving. That being said, you still want to be mindful of moisturizing the skin as I described for shaving and waxing. And you have to pay attention to your own skin needs. If your skin is still dry and irritated after having removed hair with laser hair removal, you still want to practice the moisturizing. You still want to protect your skin in the way that I described earlier. Now, I hope that answers your question, and let's move on to the next one. And this one is from Monica. Dr. B, I've heard it both ways and need your help. Should I scrub first and then cleanse, or cleanse first and then scrub? Tell me why, please. Well, Monica, I'm very glad that you asked me that question, and welcome to my world. I get asked that question day in and day out. And the short answer is that scrubbing and exfoliation, as I'd hinted to earlier, are actually nonsensical practices. They have very little value, if any, for skin, especially when you're dealing with dry, sensitive skin, because what they do is they heavy-handedly physically abrade and upset the skin barrier. And believe it or not, they do not have any proven benefits for skin. So a lot of people do those or exercise or practice those techniques in good faith, thinking they're getting some sort of a health benefit. But in fact, there is no proven health benefit to these practices. And what they do actually accomplish is irritation and undermining of the skin barrier, which, if you already have sensitive skin, that means that your skin barrier is actually weak. It's not as well functioning, and it needs all the help it can get, especially when it comes to first doing no harm, which is what exfoliation and scrubbing does. Now, this goes also for the more gentle techniques of cleansing and removing skin dirt, if you will, or other terms that the skincare industry has made up for things that need to come off the skin. So cleansing is another practice that is largely unnecessary, especially when we're dealing with areas like the face or the arms or the legs. Those areas do not necessarily benefit from cleansing. In fact, there is no great benefit for these areas to be cleansed. And what you do accomplish when you cleanse is, again, removing elements of the skin barrier, which if you have sensitive skin is already struggling, is already weak, and needs all the support that it gets. So that is something that I recommend for people to take it easy as far as cleansing, and certainly scrubbing I recommend to avoid altogether. But what I do recommend is using lukewarm water over the arms, the legs, and the face if you can. And when areas such as the armpits, groin, and the gluteal cleft produce body odor, then address those with a cleanser or with soap, but avoid scrubbing them altogether. I hope that answers your question. And I know it sounds confusing, but there's a lot of skincare promotional material out there that can be very confusing to you. And I want you to get the truth and treat your skin right. Well, that is all the time that we have today. Thanks for joining. I'm Dr. Yuval Bibi. See you on the next episode of Ask the Doc, No Appointment Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.